The proceeding will start shortly.
Order, order. Andrew Griffiths to move the motion.
Thank you, Mr. Pritchard. It is a great pleasure to serve under your chairmanship, and I know we could not be in better hands. And it's a delight to have the Minister here, who I know comes at this with a great personal interest and great commitment to deliver for all of our constituents. And it's fantastic to see so many honourable and right honourable members from across the House taking part in this debate. I think it's testament to the level of interest there is in this place, but also the level of concern there is across the country in relation to mental health more generally, but specifically in relation to children's mental health. And it's at this point that I'd perhaps like to praise the government for what they have done to date. There's no doubt about it that this government gets it in relation to mental health, that this government has made it a priority like no other in order to prioritise and attack the stigma of mental health and to put much needed resources into the issue of mental health. But I think we would all say that whilst that is great work, a bit like Oliver in the movie, please, Minister, can we have some more? Because I think we all recognise that whilst we are getting on board in relation to the issues of mental health, whilst we're getting royals and TV stars and politicians and people from sport and all areas talking about mental health, we are a bit like the snowball going down the side of the mountain. The problem is getting bigger and bigger. And I think in relation to children in particular, the pressure on our children, the demands that are placed on them and the stresses that are being placed on their mental health mean that this is an ever-increasing problem and therefore demands not just our attention, but our resources and our commitment as a government if we are to tackle it. Because 1 in 8 5 to 19-year-olds, that's 12.5%, Mr Pritchard, with my maths, or 1.25 million children across this country have a mental health difficulty, according to the government's own Children and Young People Prevalence Survey of November 2018. The Local Government Association says that children's services are seeing more than 560 cases of mental health issues every day. And 75% of adult mental health illnesses begin before someone is 18. And over 50% start before the age of 14. 23% of the population are affected by mental health difficulties at some point each year. And economic and social costs of mental illness in England is £105 billion. I will, of course.
Congratulate the Honourable Gentleman for giving way. About 10 or 11 years ago, I had a bill, in actual fact, that would have taken a cluster of schools and you would have had a specialist there that could, in other words, help teachers to identify children with health problems and mental health problems. Doesn't it agree with me that that's something that the government should think about? And secondly, the most important point, I don't think employers at times recognise young people when they first start out in industry, the difficulties they have with mental health and adult health for that matter. Would you not agree with me that more could be done in that area?
It's a pity that more people didn't have the foresight that he had and that we had acted sooner because, as I said previously, Mr Pritchard, we are laying the foundations for difficulties, mental health problems in adulthood, and we see the lifelong impact on people from issues of childhood mental health. And that's why it's so important that we don't waste a moment. Rates of depression and anxiety increased by 70% amongst teenagers in the last 25 years. I will, of course.
And for securing this important debate, I would just briefly like to mention Elodie Fleet, who is now 18 years old. She is an Ashfield constituent. Her anxiety came to a head at 13. She wanted to see the school counsellor, but, and I quote from Elodie, because she hadn't tried to hang herself or taken a blade to her wrist, her needs were not deemed urgent enough, and I hope the Minister will go on to say how we can get more counsellors in our schools to deal with people like Elodie. She's not alone.
I thank the Honourable Lady, and the point she makes is very powerful and is indeed absolutely true. She is not alone. I think the thing that amazed me when I publicised this debate on my Facebook page is the number of parents that got in touch. I was overwhelmed by parents who've either battled through this and managed to get to the other end, or who are in the midst of fighting to keep their children alive, to keep them safe, to keep them well. And as a parent myself, and all of us realise just how what a scary thought that is. I'll give way.
Honourable Member for giving way. Just to reiterate the point, would he agree with me that this is a state of emergency, whereas in my constituency, parents are being advised of a 72-week wait, 72-week wait for their 12-year-old son to get help, even though there is risk of serious self-harm. 72 weeks.
I understand the point the Honourable Lady makes. I agree, we are in crisis. And I also point to the fact that the government are putting record amounts of money into this. But she's absolutely right. I'll come on to waiting times in a moment, if I may, but she's absolutely right to say that that is an unacceptable wait, and any parent would be terrified at that thought, and any child would actually be more harmed with that long wait. I'll give way quickly.
Thank the Honourable Member for giving way, and the statistics that he is outlining are horrific. But some years ago, some of the figures released that across the whole of the United Kingdom, over 10,000 young people under the age of 10 were manic depressants. That is a horrendous figure. And the pressure that brings on the parents and their carers has to be horrendous.
The Honourable Gentleman makes a very valid point. And I'm somebody who's spoken openly about their own mental health challenges and their own battle with depression and anxiety and those things. As an adult, it was incredibly difficult to cope with. But as a small child, it must just be an incredible thing to have to deal with. I'll give way one more time and then I'll make some progress, if I may.
I thank my honourable friend. Regarding my honourable friend's point about the social and economic effect, does my honourable friend agree with me that we need more of a joined-up approach cross-department? I'd just like to give an example. Earlier this year, I met with Chief Superintendent Paul Hepworth of West Yorkshire Police, fantastic guy. During our meeting, he raised that there's a lack at a national level of forensic beds for children with severe mental health issues. He told me of a story of a young girl that the police had in custody with a severe illness. She was suicidal, self-harming and violent towards others. Now, does my honourable friend agree that this issue must be addressed by the government to offer a safe space and support for people in dire risk? Thank you.
And I'd point to some of the work that my own Police Commissioner, Matthew Ellis, has done in Staffordshire, and also the work that the Prime Minister did when she was Home Secretary in terms of how we treat mental health in our police stations and in those cells is very important. But it's even more important for vulnerable young children, and she makes a very valid point. If I can just canter through a few of these points, Mr Pritchard, and then I'll take some more interventions. Again, the government's own survey shows that 1 in 4 children with a mental health disorder are seen by a mental health specialist, and that there are over 400,000 children receiving no assistance at all. So just 1 in 4 are getting the treatment that they need. And the truth is, the NHS is only managing to see a fraction of the young people who have problems. Now, I'm delighted that the Minister's here, because you talked about cross-departmental working. The Minister has done a huge amount to bang heads together and make this a priority. But it is NHS, it's local government, it's police, it's so many different areas that we need to get to bring together. The Children's Commissioner's analysis of NHS figures from 2018 show that 325,000 children were treated by community services, while there are another 5,000 in hospital. That is fewer than 3% of the population. Around £700 million is spent on CAMHS and eating disorder support. By comparison, services for adults receive 15 times more, despite children representing 20% of the population. So whilst it's important and great that we're putting money into mental health services, we're actually turned it on its head almost. We need to be putting more money into children's services, not simply because there's that great demand, but also if we can nip it in the bud there, if we can take that early intervention, we can stop the need for those services later on in life. I'll give way to my honourable friend.
Thank you, my friend, for giving way and congratulating on securing the debate today. And he's making some very good points. On the point he's just made about if you like, the CAMS being the Cinderella service of the Cinderella service, recognising that mental health is still woefully underfunded compared to many other parts of the NHS. Would he also recognise that CAMS recruitment is a real challenge, with August 2019 fill rates for higher trainees entering CAMS specialist training only 63% in the UK, and for learning disability only 23%, which means that almost 80% of learning disability posts are going to be unfilled amongst new trainees entering learning disabilities. And would you agree with me, this is a key issue for the government to address if they want to improve CAMS provision?
I absolutely agree with the honourable gentleman. First of all, can I congratulate him on the work that he does in our NHS in relation to mental health work in the community. He does a great job, and I'm grateful for that. But he raises a very, very important point. It's all very well having the desire and the money, putting the money in place to deliver these services, but if we don't have the staff to actually be able to deliver it on the ground, then we are always going to be running to catch up. I'll give it once more, and then I'll make some progress, if I may.
I'm grateful to the honourable member giving way, who's giving an excellent speech. In York, over the last 5 years, we've seen a 26% increase in the number of referrals into CAMS services. And as a result of such high demand, we know that 1 in 4 referrals is turned away from the service, including children who are self-harming and have experienced abuse. Surely we need to really focus on investment in the workforce as well as on funding.
She's absolutely right. And the stress that's added on to families who are having to deal with this. Imagine having a child that's self-harming. The pressure and the stress that causes in the family is also immense. So we shouldn't underestimate that. And she makes a very good point. One last time.
Thank you, my friend, for giving way and congratulating on what is a really important debate. I just want to follow up from my colleague in York Central about the figures in York. Is it not the case, though, that parents are under a huge amount of stress because of these referrals? We're seeing in York the CAMS referral times peaking and troughing, and I think that's a lot to do with the fact that we're not getting the resources. Sometimes it's down to 6 months referral time, other times it's running at over 12 months. This, when it gets to over 12 months, having a huge impact on those children, and it means that schools are actually having to take action and exclude some of these young people before they can actually get the treatment they need.
Absolutely right. And two things. The impact on schools is important, and I'll talk a little, if I may, about what we can do in schools. But secondly, that pressure on CAMS and the need to get children seen as soon as possible is massively important. Just imagine that if any of us were having a mental health episode, to be told you can see somebody in 12 months that will then refer you for treatment. So CAMS isn't the doctor that's going to see you. It's not the psychiatrist. It's not the help. That's the doorkeeper, the triage, if you like, till you can get help. So it could be many, many months afterwards, even if you've got through the door of CAMS and you've convinced them, you've jumped over the very high bar in relation to getting treatment from CAMS. So it is a great challenge, and I know the government takes it seriously. The government's 2017 Green Paper on transforming children and young people's mental health provision outlined those ambitious new plans for delivering mental health support in schools, and the announcement of the Mental Health Services Trailblazers this week is a welcome part of that, and I'm delighted that my own area, Burton, is to be in the second phase of those Trailblazers, which I genuinely do believe will make a difference. Figures from the Children's Society suggest that, however, that there's been little expansion in the provision available in schools since 2015. So we are starting from a low base. And in particular, they point to a worrying lack of awareness amongst parents about what counselling is offered in their children's schools, and with just under a third not being aware of what is available at all. I'm pleased that the government has announced that every school, college and alternative provision across England will be offered training as part of the £9.3 million Mental Health Services Schools and College Link. But the priority access to mental health training for schools and colleges in my constituency is still not available till next year, and it's clearly needed now, and I'm one of the trailblazers. So to use my Oliver analogy again, there are so many MPs here, so many constituencies, so many constituents who want access to that. So how can we roll it on quicker? I'll give way.
It is an excellent speech that my honourable friend is making. Could I ask him to reflect for a minute on the particular issues of rural communities? Because there, the distances and the lack of broadband does mean that some of the opportunities for dealing with that distance are missed. So technology, it seems to me, is one of the things that perhaps government, and maybe we'll hear a bit more from the Minister, might use more effectively in rural areas, because otherwise we're certainly not going to get the help in the time that's needed. And certainly in my schools, we're not going to get the help under this new scheme. We're not even a pilot anytime soon. And my teachers are very concerned that this is actually putting more burden on them than adding a resource.
The Honourable Lady is always a champion for rural communities, and she makes a very important point about rural isolation. We've known for a long time about the issues of rural mental health challenges for, say, farmers and rural communities. But it's all the more difficult for young people who are isolated from their friends. And also, you know, we talk about the pressures on young people in relation to social media and Facebook and Twitter and all those pressures. It's even more difficult for isolated rural kids in rural communities because they're even more separated, and often that social media connection is their only chance to talk to their friends. I think the honourable member wanted to.
He's making, I mean, I say one of the best speeches I've actually heard in this chamber for some time, in the detail that he's going into and the granularity that he's making his case. But would he also agree with me that, as we discussed earlier, on the issue of workforce, the number of mental health nurses nationally has fallen over the last decade. We know there are challenges with CAMS and LD recruitment in the medical workforce. And unless we get this workforce challenge right, you can't deliver mental health care without bodies on the ground to do it. This is just going to be rhetoric, and we need to start turning rhetoric into reality by recruiting the right numbers of staff on the ground to deliver high-quality mental health care.
It's not just psychiatrists, it's not just people at the doctors, not just the doctors. It is those mental health nurses out in the community. I've witnessed firsthand the great work that they do, and I know just how important they are. But look, you know, this extensive rollout, as the government are rightly claiming it to be, over the 5 years of this pilot, is great, but it will roll out just 20 to 25% of the country's need. And that will mean that so many young people will be missing support at least until 2023 and maybe even after. Mental health training for schools and colleges announced in the last week is fantastic. But the long-term plan for the NHS means that an extra £2.3 billion is due to be put into mental health services by 2023-24. Let's just think about that for a minute. £2.3 billion, that's a lot of money. But I want to make sure that as much of that goes into children's mental health services as is humanly possible, because I think it has that double whammy, that double effect, if we can get it spent wisely.
The honourable gentleman for giving way. I wonder whether he'd agree with me about the importance of bereavement counselling for children with mental health issues. As Shadow Police Minister, one of the most common factors I see amongst young offenders is that they've had a close family bereavement in their childhood, and yet so many children languish on waiting lists waiting for bereavement counselling. Indeed, I had a young constituent who was waiting for 3 years for bereavement counselling, and unfortunately his life was taken by another teenager, just showing the absolute importance of getting in there and delivering that mental health.
He's absolutely right. Mr. Pritchard, this is about trauma. It's about trauma in young people's lives. That is often the trigger, and whether that's sexual abuse, whether it's domestic abuse, whether it's violence perpetrated by other young people, whether it's bereavement. These are all triggers that set off a train of deterioration in young people's mental health that is lifelong often. And so it is so important that we get those access. We've heard a number of times today about waiting times for CAMS, and certainly what I've found from my constituents who could not get onto their Facebook quick enough to tell me about CAMS and their experiences. I don't want to denigrate CAMS. Great people doing great work, just not enough of them is the problem, just too much under pressure. CAMS, as we've heard, I think earlier from an intervention, CAMS are turning away nearly a quarter, 24.2% in 2017-18. Of children referred to them. That means that at least 55,800 children were not accepted for treatment in 2017-18. Of those who were referred for treatment, the average waiting time in 17-18 was 34 days for an initial assessment and 60 days for treatment. This is significantly longer than the government's standard of 4 weeks as set out in the Green Paper. And I think we can all point to examples in our constituencies, if we looked, of much longer waiting times than those. One constituent contacted me to say that her son had been self-harming for years. It took them months to get an appointment with CAMHS, and when the appointment happened, her son suffered a meltdown. I think that's not unusual, the pressures on the young people of that appointment. Because he's 15, their GP can't prescribe anything for him. She's had to watch him throughout the night to make sure that he doesn't do any permanent damage to himself. Another parent told me of her daughter. She was discharged from CAMHS with them saying there was nothing more they could do to help with her anxiety. Young people have told mental health charity Mind, and I'm very lucky to have Burton Mind in my constituency, which does a great job, that wait for support is one of the most difficult issues they face. And they say sometimes they find that mental health deteriorates whilst they are waiting. So the wait actually makes it longer. In England as a whole, half of those accepted for treatment during 2017-18 were still waiting for treatment at the year's end. The proportion was lower in my own East Staffordshire at just 1/3, but still substantial. A school counsellor from my constituency contacted me to say that the waiting list for referrals to child services outside of school can be months. When it's established a child needs help, she believes that a counselling session needs to happen within 48 hours. She goes on to say that too much red tape is preventing children from getting the help they need. And I think we all recognise, as the government has done, that support in school, delivered in a way that's accessible to young people, that they feel comfortable in going and asking for, and that they know of other young people that have accessed it, is a real help. One parent told me she decided to fight to get her sons commissioned out of the county they were living in because of her disappointment with the support she'd received. She says early intervention is key and that there have been too many endless reports and not enough action being taken. Another patient in my own constituency said she took her daughter to the GP 2 years ago. She was referred to that place in Burton, which is a fantastic facility. She took her for assessment only to be told that she wasn't old enough to be accepted. Yet another constituent told me after a referral for her daughter aged 9, it took 3 years for them to see a psychiatrist. So these kind of waits are difficult, and all the time young people are getting worse. And there is also a problem in relation to transition from child to adulthood. About 1 in 6 17 to 19-year-olds have a mental health disorder, according to the British Psychology Society. According to the Children's Society, 16 to 17-year-olds are the biggest service users of mental health services. But young people often face barriers to accessing support and end up falling through the cracks of adult and children's services as they transition. Some young people who are discharged from children and young people's mental health services at 18 find it can be very difficult to get a referral to adult mental health services at all and can end up completely isolated. And in some circumstances, young people aren't accepted into children and young people, a young person or adult mental services due to falling between the gaps. Again and again, I hear CAMHS discharge young people on their 18th birthday and that there is no provision for them at all. The challenge these young people are facing do not magically disappear when they become adults. Just on Friday, I met with a constituent who was just getting ready to leave CAMHS, and she'd been left to organise her future on her own. She was not automatically transferred to adult services and had to organise a private therapist in order to get the treatment that she still needs on an ongoing basis. I think one of my constituents sums up the problem better than I could. She said, all the time the kids are getting no support, becoming suicidal, becoming adults with even more complex issues. Families are breaking up because of the pressure, parents quitting work to do the jobs of education, social care, health. And all of this causes more and more financial pressure later on. No one sees the bigger picture because they can't afford to. No one sees long term because that's too expensive. Early interventions, she says, are crucial, but they aren't funded. We will reap the whirlwind, then wring our hands and say, how could we have prevented this? I think that's absolutely pertinent. The government have set a 5-year forward view for mental health. For 1 in 3 children and adolescents with a mental health disorder to access NHS mental health community services by 2020-21. And in the new long-term plan, for 100% of children and young people who need specialist care to access it by 2028-29. But that is so long down the track. I will, of course, give way.
I totally agree with my honourable friend. It is so far down the track. And does it not concern him further that in that same 10-year plan, the NHS talks about parity of esteem? But that's in 10 years' time, and in terms of the timelines for getting there, it's very unclear what will be done. And as the honourable gentleman says, 10 years is much too long to solve the problems we have today.
She's absolutely right. During that time, babies become children, become adults, and the problem gets worse and worse and worse. I don't deny the government's commitment and determination with this, but it's just not happening quick enough. The other thing we need to bear in mind as well, we've heard about CAMS and the pressures on the workforce, but there's also a huge amount of brilliant voluntary sector organisations that are delivering these services. I'm very lucky in my own constituency to have an organisation called Yes, who deliver in schools in Uttoxeter, Burton Mind. There are so many great organisations, but even in my own patch, I'm hearing that a tendering process is currently going on, that where the bar is so high, the requirements are so difficult, the boxes to tick are so numerous, that voluntary sector, that third sector organisations feel that they are simply unable to compete. So the challenge is that the tender goes to a private company providing the facilities, and the experience and the dedication and the benefits of those voluntary sector organisations is lost. I was staggered to learn, Mr Pritchard, that some of the charities operating in children's mental health in my constituency are providing 85 pence of frontline services for every pound they receive. That's tremendous value, help for young people. And I think there are few businesses that would be able to anywhere near match that. But the tender process that we go through makes it impossible. I hope the Minister will look at that, and I'll particularly be raising with her my own issue in Staffordshire. But I think the Minister will recognise that amongst this place, we are simply voicing the real concern, the real fears of parents up and down the country. We are trying to address that snowball that's coming down the hill, those young people whose mental health is under greater pressure than ever before, and who, as a result, are self-harming, are committing suicide, or are getting themselves into a situation where in future years they will suffer from greater mental health, addiction, and so many other problems in the long term. I hope that the Honourable Lady will go away feeling that she has great support across this House for her campaign to get even more resources and even more focus on mental health services, particularly for children, because quite frankly, Mr Pritchard, our children's lives depend on it.
The question is that this House has considered children and mental health services. I don't propose to enforce a formal time limit of 4 minutes, but if colleagues could be mindful, given the number of people that wish to contribute to this debate. John Woodcock.
Thank you very much, Mr Pritchard. Thank you for calling me early. It's a pleasure to serve under you, and in particular, my apologies to the Honourable Member for arriving late. I was in the domestic abuse statement, which unfortunately ran over a little. Can I commend absolutely what I heard him say and others intervening on this? And I'm sure throughout this debate you are going to find that this is truly, we're going to be given really shocking examples of how this is truly a nationwide crisis, that any government of any hue must, I think, as a first step, be honest about the scale of the problem and how much is being stored up for future generations, as has been eloquently put by the Honourable Member. I just want to give the Minister and the Chamber a couple of the many examples that we have had of constituents getting in touch. Drew, a 9-year-old boy whose mother contacted us in a desperate state in March of last year. Drew, on a weekly basis, talked about killing himself. He would go so far on a regular basis of putting a rope round his neck. They were seeking, obviously, urgent medical help for Drew. 15 months later, Drew had his first appointment with the CAMS. 15 months that child was at risk, that family was going through something which it is really hard for as parents to imagine your child in that distress and desperately reaching out to people to help and just being put on this interminable waiting list. Drew's mum is left wondering how best to house that family. She has been she has had her benefits reduced because of the bedroom tax. The need for Drew to have a separate room is not acknowledged, despite the fact that he is aggressive, sometimes violent towards his sibling. So she is now forced to confront the prospect of Drew actually sharing a bedroom with her. Deeply inappropriate, and signs of a system which is just broken locally. We have another example of a child who was deemed to be a clear suicide risk, where there was a significant amount of resource which was placed into multidisciplinary team meetings for the child, but meeting after meeting, for whatever reason, CAMS didn't show. So the process to provide appropriate help to that child could not go ahead, while already deeply scarce resources were being burnt up. It was only actually after the intervention of our team that we managed to bring CAMS to the table. Now, there are professionals who want to do things about it. No one goes into this field wanting to do the wrong thing. They go into it to help, but the resources are not there, and often the system which is there are inefficient resource. I want to very briefly pay tribute to the work of the local commissioning group, who have now put in some, as of last week, put in some resource for mental health professionals to work across schools. That is good, but it's not coming close to the level which is needed. And I really beg the Minister to listen and to do what she can to get the government to act.
Thank you very much, Mr. Pritchard. It's a pleasure to serve under your chairmanship. And I really want to congratulate my honourable friend, the member for Burton, for securing this debate, and just say that I concur very much with all that he said in his opening speech. And because we've only got a small amount of time, I just want to address one very specific issue that's been brought to my attention in this regard. I mean, we're all agreed that we have a growing challenge, a growing issue of mental health conditions among our young people across the country. And I think it's right to acknowledge that the government is recognising this and is acting upon this. We're very grateful in Cornwall that right now, as I speak, a residential unit for children with mental health conditions is being built in Cornwall after many, many years of not having a residential unit, and our children having to be sent all over the country to be cared for, and that will be open very soon, and that is very much welcome. But I am very concerned, particularly about, in this regard, the amount of pressure that we're putting on our school teachers when it comes to caring for children with mental health conditions. It seems to me that we're expecting more and more of teachers in this regard, and that really isn't their role or their responsibility. And I'm very concerned about the impact this is having on our teachers. But I'm also very concerned about another aspect with regard to education, and that is around the issue of authorised absence. I know this isn't directly the Minister's responsibility, but hopefully she can take these remarks on board and feed them back to the Department for Education, because I have many parents coming to me on a very regular basis now saying that they are struggling to get the school to support them as a family when they need to take their children out of school because they have mental health concerns and conditions. Whether that is to attend appointments with CAMS or other organisations, or in one case where the school was refusing to recognise absence from a particular child who was suffering with a mental health condition until that mental health condition had been formally diagnosed by CAMS. And as we've heard today, it can take many months. I've heard up to 18 months to get a diagnosis from CAMS. And the school was sending letters, warning letters, home to the parents about the amount of time that this child was having away from school and threatening to take action and legal action against them because the amount of time the child was missing. And all this was doing is exasperating the problem, putting more pressure, more stress and de-stress on this family at an already very, very difficult time. And so I would just appeal through the Minister to the Department for Education that we need to get our teachers, our head teachers particularly, being more understanding and more compassionate in this regard. They're being driven by a heavy, very heavy-handed approach from Ofsted, I believe, in terms of meeting their attendance targets, where it now seems that this, above all else, is the most important thing for school. And there's no recognition within that to make allowances for the very real challenges that many families face when they have a child who is suffering with mental health conditions and is therefore unable to attend school on a regular basis. And they are being have huge pressure. And what I'm concerned about is, many of these children are aware of what is going on. And what that encourages children to do is to bury the issue and go to school because they don't want the pressure put on their parents, rather than open up about the issue and get the help and the support that they need. And so I believe that we really need to make sure that schools are working with parents and with families when they have a child who is facing these issues, and not add to the problem, not add to the pressure that their family is under. So I would just ask the Minister to take that on board, and if we can do better in getting schools to recognise the concerns and the conditions that many families face themselves in, and work with the family rather than exasperating the problem.
It's a pleasure to speak under your chairmanship, and I applaud the honourable member for Burton for securing this debate. Children and young people's mental health is incredibly important. I appreciate the contributions from previous members, honourable members, and recognise similar situations of children suffering in my constituency. I'll not repeat some that I had. Firstly, I want to say I want to focus on 3 issues that I think are important to the mental health of our young people. Firstly, I want to raise the issue of young people's mental health within our judicial system. I spoke about this issue within this hall only a few months ago to highlight the fact that young people with mental health issues had been forgotten from the government's response to the Justice Committee's report on the disclosure of youth criminal records. What I would emphasise in this debate is that when we look at the funding plans for young people's mental health from the government, which are welcome but could stand to go further, do not forget the vulnerable young people that have been taken out of our mainstream schools and placed into the care of the UK's judicial system. Many of the young people within that system may not understand why they are there and are placed under stress and pressure that even we as adults would struggle to cope with. We must ensure that this does not lead to the degradation or further degradation of their mental health, which may damage their chances of rehabilitation. Secondly, I would like to raise the issue of personal, social, health and economics, also known as PSHE, formerly known as citizenship in schools, for those young children who are still in our system of education. Frankly, this provision is woefully inadequate for the issue it is trying to tackle, with little or no guidance from central government and being almost completely up to the school on how this provision is conceived and delivered. This has produced an almost laughable system where each school may have a completely different interpretation of the curriculum and its requirements. In one school, they may require 15 minutes a week during form time, yet 30 minutes down the road, might get a school gives an hour's lesson once a week. Within that time, teachers are expected to cover everything from mental health to how mortgages work, to sexuality, to how government and this place works, all in that time, with little or no guidance. Many schools simply do not provide the time required to tackle these subjects properly, often within the lesson material either being put together by a teacher who happens to have the time. or a third-party company who does little or nothing about it, neither of which may have the necessary subject matter expertise. I call on the Government today to get to grips with this issue and make PSHE a statutory subject with guidelines on the content of the subject area that doesn't essentially amount to "it's up to you." With a key focus on mental health, which is too important to have such vague guidelines. Finally, I want to touch upon the subject of loot boxes in video games. For those who don't know, loot boxes are a mechanic in video games that require you to pay money to get a box or some kind of a pack. Within this box, you might get a piece of very good equipment, a rare boost or character that will give you an edge when playing online against other people. Or you might get something that's rubbish, or you already have, that is virtually useless to you. To put it in plain English, these loot boxes or surprise mechanics are essentially gambling. These mechanics also have no impact on the age rating of the game, meaning young people of all age ranges can be exposed to what basically is gambling mechanics. Now, I'm not one of these people who believes video games are bad for young people and it's rotting their brains, as some would put it. But I do believe that gambling mechanics such as these can only do and do have a negative effect on young people's mental health and cause addiction. There is a reason that we have age restrictions for fruit machines and gambling websites, and even then we can see the negative effect this has on adults. I therefore call upon the Government to follow the lead of countries like Belgium and step in to deal with these gambling mechanics and their impact on mental health to our children.
Gillian Keegan.
Pleasure to serve under your chairmanship. 1 in 9 young people aged between 5 and 15 has a diagnosable mental health condition. So I want to thank my honourable friend, the member for Burton, for securing this vital debate. And the issue becomes more pressing as figures suggest that these children are twice as likely to carry mental illness into adulthood. But the government are obviously taking some action. They've invested £1.4 billion to improve specialist services for mental health. But, of course, we're playing catch-up. Pressures on the younger generation are at a new high with the advent of social media. There is a constant pressure to keep up on platforms like Instagram, Snapchat and Facebook. And this is compounded when we look at their exposure to image and celebrity culture. And while social media has the power to be a power for good, it's all too often clear that these platforms can have a detrimental impact on children's mental health. And we've already had some truly devastating cases, such as Molly Russell, whose suicide sparked this important conversation nationally. And I welcome the current review underway by the Chief Medical Officer, Dame Sally Davis, who is assessing the impacts that social media has on a child's mental health. Another mental health condition on the rise, especially in young people, are eating disorders. And I recently met a constituent, Lizzie Speller, here in Parliament with the charity Beat UK. They support people with eating disorders, and Lizzie herself spent several years fighting anorexia. And when she overcome her long battle, she did get the help she needed. And I think it's fantastic that 4/5 of young people with eating disorders do now receive treatment within just 1 week. And Lizzie is doing a lot now to help other people. She has set up mental health mates walks at Chichester Community Group, which has a monthly city walk. My husband and I joined them earlier this year. And it's an ability to just meet and talk about things that concern you. The role of Beat is important in overcoming, in spreading this network across the country. Another Beat ambassador is my goddaughter's sister, Isabella T. She herself worked hard to overcome anorexia as a teenager and is now working to support others at York University. Schools have a vital role in offering support and spotting signs where people need help, and many schools across my constituency, Chichester High School, Bourne Community School, to name but a few, have done a lot to support mental health in schools and have trained mental health first aiders and pupil mental health ambassadors. But on-the-ground visible services are exactly what we need, and I do look forward to seeing the impact of the new mental health support team pilot in my area as Coastal West Sussex CCG are taking part in the first wave. Getting to grips with mental health is so important, as the consequences of not doing so are unimaginable.
On the 17th of July 2017, one of my constituents, Jo Marsden, had her life turned upside down when her 20-year-old son, Ned, took his life at Whitley Station. Ned had been excluded from school earlier in his life and over the years had withdrawn from his family and his friends. His mental health issues were well masked and not identified at school or later when his doctor tried to identify signs. And I've met Jo several times now, and she's an inspiring woman. She's created Ned's Fund that offers vocational courses to young people who drop out of school. And she said, my dream is to help as many children as I can by funding vocational training. I'm not a fairy godmother, but nothing would bring me greater happiness. And the impact of suicide on a young person is truly devastating. And my family knows this from personal experience when my young cousin Sally Gibson took her life some years ago. People across Chichester are continuously coming together to improve each other's lives, and tackling mental health needs a comprehensive approach where at every part of a young person's life someone is available to give a much needed helping hand. Thank you.
Can I thank the member for Burton and Gresham for securing this debate. It's important because the simple thing, we're going to change attitudes around mental health in this country, just to talk about it. And I think the more we do it in Parliament, the better it is. And can I pay tribute to all those included charities such as Rethink Mental Health have made a real change, a step change in the way we do mental health or consider mental health in this country. Could I also, I think, pay credit to the Minister? I mean, she obviously doesn't know what's going to happen next week in terms of change of Prime Minister, but she's been a great champion for mental health. Not just in terms of doing the work she does, because she cares about it, Mr Pritchard, and you get that from a minister sometimes who is just going through the motions. This is a minister that actually, I think, fair to it, deeply cares about this subject and has made a real difference in the area. Now, finance has been an important point in mental health. It's been made over the years, not just in adult services, but also in children's services as well. It's been made again today. Workforce and having the right proper workforce there is also important as well. And I do not want to relegate those two issues at all, because they're very important in this debate. But the other thing which often doesn't get spoken about is having proper pathways into service, which I've got to say, it is a mess at the moment. And it's a mess partly through reorganisations in the health service. It's also, if you look at cuts, for example, to local authorities that are no longer able to afford to fund voluntary sector organisations and others, Sure Start centres being cut, they're having an impact on people having access to services. And can I pay tribute to CAMHS, because they do get a bad name, but they're trying their best. But it's an impossible job we're giving them. We've got to try and turn down the pipeline of people going into CAMHS services. And the only way you're going to do that is if you actually have a proper triage system before you go into CAMHS, so that people know whether they can get help elsewhere. We often, I think, in mental health services over-medicalise it, and I think one of the pilots that the Tees, Esk and Wear Valley Mental Health Trust in my area has been piloting is a good one. What they've done, they've paid for a psychiatrist to sit in the GP surgery, so that there's a mental health professional in the GP service who can then triage triage cases as they come in. Because we're the best one in the world, and I don't want to criticise GPs at all, is they're not mental health professionals. Have the mental health professional there, triage the cases that need to go through to CAMHS or other adult mental health services, and then try and help the others. And that's where I think we do need a network locally of support organisations, whether that be voluntary sector, as the Honourable Member for Burton quite rightly points out, or others that are doing fantastic work. But he does put his finger on an issue, and it's the way we tender for mental health service or services. I'm sorry, the ones I speak to in County Durham are too, the contracts are too big, they've not got the capacity to take these on, but they're doing valuable work in the community. And actually, I think in some cases would be a way of taking pressure off the pipeline that are going into CAMHS and also adult mental services. So, when you actually have parents, they want to know where to go. And that's what we need. We need those signposting pathways so people aren't waiting, the 12 months, if not longer, to get into CAMHS, though somehow that is actually going to answer their questions. Briefly.
gentleman for giving way and for the great speech that he's making. But just very quickly, does he agree that one of the reasons they tender in that way is because they want to have a uniform approach across, say, the whole county? But in reality, if you want access to a service, people understand the local charity and are much more aware of the local charity and are much more likely to go to it for that very reason.
Well, but in my experience, some of the best examples of mental health support locally is being done by local charities. And frankly, most of them run on a shoestring. They're not asking for huge amounts of money. It would actually be, I think, very cost effective for the taxpayer to direct service into that. But we have to have that joined up system. If we don't, we can pour as much money as we like into this system, Mr. Pritchard. It will not work. Can I just mention one last thing, and that's students' mental health, especially being highlighted around universities. Can I ask the Minister possibly to contact Northumbria University, who are doing some innovative work around using new technology to track students and actually trying to highlight those that are vulnerable. I saw it a few weeks ago when I visited the university. I think it's a new model which could have some implications nationally, and I think it is something worth looking at. But can I just finish by saying this? Let's just keep on talking about this subject.
Thank you very much, Richard, and I thank the Honourable Member for securing this important debate. And I imagine there is not even a single member in this House who would diminish the importance or severity of this issue. We all want to see every child get the best possible start in life. But this is an empty commitment if we do not make sure the right level of support and help is available for children who suffer from mental health conditions. Just as we would for children with physical injuries, we would never allow a child with a broken leg to suffer alone, without professional treatment, nor should we fail to provide a child suffering with depression or anxiety with the support they urgently need. In the past, this issue has not been given the priority it clearly deserves, so I'm glad that finally a consensus is starting to build around the importance of improving mental health services for children and young people. But despite the acknowledgement that so much needs to be done, the government has failed to act decisively on this issue. Identifying a problem is all well and good. What we need is real leadership, concrete solutions and properly funded services. At present, they are failing on all three fronts. Not enough has been done to address the inadequacy of funding for services, or to reduce the number of children who don't have access to mental health support at all. The government's Children's Services Early Intervention grant has been reduced by almost £600 million since 2013. It is projected to decrease by another £100 million by 2020. So children's services are now facing a funding gap of £3 billion by 2025. This underfunding is taking place in the context of a rising demand for children's mental health services. Underfunding leads to a vicious cycle, as the support necessary for good mental health through services like housing, education, and family support is gradually cut away. When these resources are unavailable, early intervention becomes impossible and mental health problems are left to fester and deteriorate, finally requiring urgent medical intervention. Children are not suffering from more mental health problems at random. The conditions for mental ill health are being created by austerity. That is why I support the recommendations of the LGA's Councils Can paper, which calls for the empowerment of local government to lead their communities and improve young people's mental health and well-being. And my honourable friend just mentioned about great point about signposting pathways and also helping the charities, which is very, very important. Properly funded housing, education and family support services need to be given priority to ensure the well-being of children and young people. Councils are uniquely placed to do this. That is why they need to be properly funded and at the heart of our efforts to address this issue. Inequality is also a huge issue in the delivery of mental health services for children and young people. Research this year from the mental health charity Mind found that the vulnerable people in some regions struggle with little more than half the NHS funding of those in the best resourced areas. To give one example, in Surrey Heartlands, the average annual spend on mental health services per head of population is just under £125. But in South Yorkshire and Bestlaw, that figure is over 220. So I must say that the government must need to act as soon as possible. That crisis is absolutely huge. Thank you very much.
Thank you very much, Mr. Pritchard, and it's a pleasure to serve under you. I want to congratulate the member for Burton both for bringing this debate, but also his excellent speech, of which I almost wholeheartedly agree with. Now, I carried a constituent survey out on mental health services for young people, and the responses showed how worried and concerned constituents are, and that they're feeling that the situation is getting worse. The top issues that came out when we analysed the results of the survey: number one, long waiting times; number two, one only gets care after self-harming; and three, the police were having to intervene to protect at-risk young people, i.e. coming into notice of the services far too late. One example, a parent said that they had to visit the GP 3 times, and only after their child self-harmed were they referred to CAMS. And another, speaking of her daughter, said her future has been robbed by mental illness, and the NHS didn't have the staff or resources to make a difference when it counted. Now, the Honourable Member for Burton and others here today have outlined so clearly the need for more funding. And if the Minister needs ammunition to help her in her arguments in the spending review, just think of the cost to the nation of not adequately funding early intervention and adequate CAM services before things get to crisis levels for these young people. I'm going to cover just briefly early intervention and schools. Universal services, both in education and family services, youth services, etc., voluntary services as well, are a vital part of early intervention, identifying at-risk children and then signposting them towards dedicated services. That's where you need fully funded, universal, as well as specialist services. But with Shaw Centre cuts, youth service cuts, cuts in school funding, means a loss of welfare support and many others. But these are the people who pick up the issues and support and refer, and that's why austerity is not just, in the case of mental health, this isn't just an issue about CAMS, but all of those services. For instance, my local authority, London Borough of Hounslow, has lost 40% of its total income due to an over 80% cut in government grants. So that's meant that they've had to cut direct and commissioned services. And now we're seeing how cut after cut is having a detrimental impact, not only on young people's life chances, but also on their physical as well as their mental health. Now, secondly, the schools are such a vital part of early intervention, as other members here have said. And when we discuss the role of education and mental health, we need to remind everyone that our schools are facing a funding crisis, having to implement a real term funding cut of about 9% since 2010. And in FE, in further education, that's worse. They're losing an average of 20% cut in funding, and certainly my local FE college is doing that. And that impacts on their ability to support young people in crisis. Now, teachers and school staff are already overworked, and welfare and teaching support has had to be cut. But teachers often can spot the problems. However, they're not trained to treat mental health. And even an additional point is they're often not trained. The nature of teacher training, often there's no space for teachers to learn about neurodiversity, dyslexia, dyspraxia, autism, ADHD, etc. And it even takes teachers a while to recognise what the problems are, and that in itself causes mental health problems. But even when they do identify at-risk students and are able to refer them, then they face the long wait times and so on. So we're lucky in Hounslow. We've been successful in getting an 820,000 grant funding for specialist mental health staff based in hub schools. That's good. We're one of 25 pilots. But it's not enough, and I'm afraid I don't agree with the government in saying that they're spending a record amount in this area, because we've seen so many cuts. I believe we're spending a lot less than was funded under the Labour government. Thank you, Mr. Pritchard.
Thank you, Chair. Pleasure to serve with the chairmanship. I'd like to congratulate the honourable gentleman from Burton for securing this important debate. I'd also like to thank my honourable friend, the member for Washington and Sunderland West, for securing a debate in the Chamber last week on this issue. Good mental health is important for us all, especially in childhood and adolescence. And if mental health problems in childhood and adolescence are not properly addressed, they can continue into adult life. This is not a problem just one part of the country. It truly is a national crisis. I appreciate that much of today's debate will focus on children's mental health services in England, but I want to highlight the situation in Scotland. The number of young people in Scotland taking their own lives increased by 50% last year. And I will repeat that figure. An increase in Scotland of young children, 50% increase in suicides. We are losing young people who have so much to offer, but find themselves suffering in silence. This is a national tragedy across the UK. The Scottish Government pledged to reduce the number of suicides in Scotland by 20% by 2022. If that pledge is to be met, we need to see some serious action to improve mental health support for children and young people in Scotland. The Children and Young People's Mental Health Task Force made a series of recommendations, including joint working between the Scottish Government and the local governments, to reform the way the mental health support is provided. I would urge the Scottish Government to enact these recommendations in full. The Scottish Children's Service Coalition has called for an increased investment in specialist mental health services. I back that call, and I hope the Scottish Government will respond positively. But investment alone is not the answer, Chair. We need to tackle the underlying cause of mental health issues among children and young people. 60% of the young people in Scotland say that the pressure to succeed have led them to feeling overwhelmed or unable to cope. 1 in 5 young people have said they are ashamed of the way they look. Others have experienced mental health issues as a result of their school environment. We have to look at new ways of supporting the mental well-being of children and young people. That's why I welcome Give the Youth a Chance petition, started by families of 3 young men who took their own lives in Lanarkshire. The petition calls for suicide prevention and mental health support programmes to become mandatory in schools across England, maybe across the UK as well. That would be a positive step in ensuring that the mental health support needed by children and young people was more readily accessible to them. In conclusion, let me conclude by saying that the state of children and young people's mental health services is a national crisis. They are being let down across the UK by inadequate funding of specialist services and growing waiting lists. It's time for both the Scottish Government and the UK Government to listen.
Thank you, Mr. Pritchard. It's a pleasure to speak on this. First of all, can I congratulate the Honourable Member for Burton for bringing the debate forward. It's a tough time for children to be children. When I was a child, it wasn't yesterday. I went to school, came home, did my chores, then out to play with the rest of the children. We didn't have much, and yet it was all we knew. This is not the case now. Children are under so much pressure to have the best gear, go to the right places, look a certain way, behave in a certain way. There's no closing the door at night to get away from the pressure. Social media follows them everywhere, and so does the pressure. I was horrified but not surprised to read that 1 in 10 school children in Northern Ireland have a diagnosable mental illness, with 35,000 children being treated by the CAMS in 2018. We've just done an inquiry on education and health through the Northern Ireland Affairs Committee, and those figures have been reinforced. Indeed, I would go as far as the fact is that I have parents in my office whose child is on the waiting list for the team who can't get on it. There are many more who should be on the list but aren't, so it's well above, I believe, the 35,000. The fact is that schools now find themselves in the front line dealing with the day-to-day anxiety and trying to help how they can. It's not enough. An article just quoted by Dr. Phil Anderson, a consultant psychiatrist in CAMS with the Belfast Trust, is saying research shows that there has been an increase in the emotional difficulties in children, a 50% increase since 2004. Absolutely horrendous figures. There are various reasons given for this. One is social media and the rise of cyberbullying and the screen time. Some people have said it's a result of rising economic inequality and, of course, academic pressures. We don't have the tools in place to deal with this, and yet our young people are crying out for help. I want to give just one very quick example. I had a young lady in my constituency called Katie Graydon Spence. She recently shadowed me in this place, Mr. Pritchard, for over in the last few days in Westminster. This is one young lady who's been open about her struggle and anxiety and her mental health. She published an anthology of poetry called Searching for Freedom, in which she paints the scene of emotion in so many young people. Katie was a finalist in the prestigious category of the Primerica Spirit of Community Awards in recognition of her poetry and the fundraising she did for Action Mental Health, as well as outlining her proposals on peer-led mentoring with schools, the Department of Education and the All-Party Group on Mental Health. An inspirational young girl and inspired as well. This young girl who is fighting these battles, but she is also fighting for others for age for whom we are feeling. And this is a question we must ask. I'm so thankful to the member for raising it today, but I will be more thankful to learn how we're going to radically change how we deal with children's mental health within the UK. They are struggling. They need us to do more, and I look forward to hearing how we will put funding to the right places, guarantee that there are controls of social media to prevent cyberbullying and trolling, and just ensure that young people know that they are loved, they are important, they are matter in their home, in their community, and all the way over here in this place, in the House of Commons.
Through this debate in a timely manner, Dr. Lisa Cameron.
Many thanks, Mr. Pritchard. Oh, and I'm not sure that this is working as yet. No, it's the other ones come on, I'm afraid. It's all right, I'm diverse, I can move across. So thank you so much. It's an absolute pleasure to serve under your chairmanship, and I would like to start by thanking the MP for Burton for it's just an extraordinary debate, actually. There has been so many contributors from across the House, so many interventions. It shows just what a high priority this issue is in all of our constituencies. It's important that it was brought to the Chamber today, and his speech was detailed, extensive and very passionate, and he's representing his constituents assiduously, so I congratulate him for that. We heard today about the main issues. I will not go through them all, but just some to point out. Workforce, obviously, an issue. Minister, training and access to services. Prevention as well as treatment. Trauma and eating disorders, and we heard about social media and how technology can be helpful in terms of signposting people, but also can be an agent for undermining mental health in young people too, and so appropriate safeguards must be put in place. Constituency cases we've heard from all across the United Kingdom. The Office of National Statistics show that the highest rates of suicide are in North East England and Wales, but all governments, I think, across the United Kingdom need to make this a priority issue. And I do thank the Minister, because I know that she has been working extremely hard on this issue and has made significant progress. I think one of the issues is, though, that we had such a long way to come in the first place, that we're not at the place we yet need to be or want to be. I'd like to thank the British Psychological Society and the Paediatric Psychological Network for sending me their updates and their views, and for particularly pointing out to me the issue with access to CAMS and how CAMS services continue to be run on medical models, really. So if a young person presents with suicidal thoughts or behaviours, unless they have also a concomitant mental disorder such as depression or eating disorder, they don't always gain access to the treatment part of CAMS. And I think that's wrong, because not every young person is going to be able to be classified medically as having a disorder, but at the same time they need access to coping skills treatments, they need access to counselling, perhaps family therapy. It may be social issues rather than a medical diagnosis that's the issue, but they still need access to that crisis care to prevent suicide in young people. It's been brought home to me just in the last couple of weeks. In East Kilbride, we suffered our very own tragedy. Ryan Coleman, a young man with his whole life ahead, took his own life just the other week, and I'm going to a tribute event to mark his life and what he accomplished in such a short space of time, and to support his family and friends this weekend. But really, families should not have to be going through these tragedies, and as a Parliament we must do much, much more. Also to thank the Trust Jack Foundation in Stonehouse, who set up young people's services to bridge the gap between referral to CAMHS and actually being seen in CAMHS, so that something can happen in between and young people can have access to support from other young people who experience mental health issues, and also support-based activities and therapies. And that again came out of a personal tragedy, the loss of Jack. Once again, his mother, a wonderful woman, has turned this tragedy into a positive for the other children right across the area, and I can't thank her enough for that. We know that transitions are really important, and we need to focus on the transition from child to adult mental health services, and also services in colleges and universities. And I'd also just like to finally ask the Minister if she could also update me and have a think about those children who have lost a parent in service in the armed forces. I went to a particular event a couple of weeks ago with the Armed Forces Parliamentary Stream, where I found out that there's a lot of work going on in the US to support young people who lose a parent in service, but that there's not so much in terms of support and treatment and access to that in the UK. And obviously, if you lose a parent who's serving in the armed forces, you also lose your home, you lose your support network, you have to adjust quite dramatically, and for young people that is a really critical time. So just to conclude, I want to say that I think governments across the United Kingdom are trying their very best in regard to improving services, but we do have a very, very long way to go, and I want to help everybody across Westminster and across all of the other governments to make sure that the progress that we need to make is actually achieved. Thank you.
Thank you, Mr. Fisher. It's a pleasure to serve under your chairmanship, and I'd like to start by congratulating the Honourable Member for Burton for securing this very important debate, but also to thank members on all sides who have contributed some extremely moving testimony, both from their own lives and from their experience as constituency MPs. And I'll make some reference to some of those contributions during my own. Fundamentally, children's mental health services are in crisis because funding is inadequate and prevention has been cut at a time when the pressures on children are higher than they've ever been before. Difficulties in childhood, like growing up in poverty or experiencing neglect or abuse or childhood bereavement, as we heard from the Honourable Member for Sheffield Heeley, these things can have a huge impact on a child's mental health. But there are also new pressures on children that many of us didn't experience, but that affect all children, like the increase in exams and tests in school, or the rise of social media that's created new forms of bullying, or put new pressures on children over their own self-image and how they feel about their own bodies. And I'd like to explore the issue of childhood trauma a little more, because I think it plays a very important role in developing a higher incidence of childhood mental ill health. There are 3 high-risk factors that indicate a newborn baby's life chances will be dramatically reduced. They are having a parent who is addicted to drugs or alcohol, having a parent with severe mental ill health, or a child witnessing a parent being subject to domestic violence. Any one of those 3 factors creates a very significant risk for that child. But it's shocking that there are 16,000 babies born every year in this country to parents with all 3 of those risk factors present. Those children without intervention and support have very little chance in life. They will become the young people committing knife crime. They will end up in the care system. They will fill our prisons, as the Honourable Member for St Helens South pointed out. They will end up living on the streets. They will develop mental ill health, and they will die younger. The Honourable Member for Coatbridge points out the alarming increase in the rate of suicides. 1 in 3 mental health conditions relate directly to adverse childhood experiences. A study by Safe Lives shows that over half of children who witness domestic violence develop behavioural problems and have difficulty forming relationships later in life. Their fragile young minds are deeply traumatised by seeing their mother beaten up,
by a violent and abusive partner in their home, which should be a safe space in which to grow up. Professionals don't always recognise the problem underlying what they may term difficult behaviour, may be mental ill health caused by traumatic experiences in earlier childhood. Professionals who work with children aren't routinely trained on how trauma can affect behaviour, so the child doesn't get the help they really need. We need services to get dramatically better at identifying when challenging behaviour comes from trauma, so we can treat the problem at source rather than continuing to fail the child who had precious little chance from the moment they were born. Mental ill health doesn't only affect the most vulnerable young people, of course. 1 in 8 children, as we've heard this afternoon, experience mental ill health. Yet the recent NHS mental health prevalence survey found that only 1 in 4 young people with a mental disorder are seen by a mental health specialist. The Honourable Member for Durham North is quite right to call for better access to care. And as the Honourable Member for Brentford and Isleworth said, on average it can take 3 visits to a GP before a child is referred for specialist assessment. And then they have to wait 6 months for treatment to start on average. And of course there are far worse waiting periods than that. We've heard this afternoon from the Honourable Member for Ashfield a 72-week wait. And for the Honourable Member for Barrow-in-Furness, a young man, Drew, waiting 15 months. For an assessment to CAMHS. For all that time, the child's mental health condition is getting worse. That is a very long period of time for that child and very serious implications for the rest of their lives. Many more severe mental health problems could be avoided if we invested more in early help and prevention. We know it works, but the Cross-Party Local Government Association points out that children's services are now facing a £3 billion funding shortfall. My honourable friend, the member for Warrington South, referred to that. And that means the lack of early intervention work is now reaching an absolute crisis point. This country is failing some of the most vulnerable children in our society and then blaming them for our failure to provide the help that they needed. Thousands of young people didn't have a chance from the moment they were born. Now, I have the highest regard for the Minister from our previous interactions on related issues, and I understand her deep commitment to these issues, so I hope she will act on what she's heard today. And I would like to ask some specific questions of my own before she responds. Will she ring-fence NHS mental health budgets and require that they are spent on mental health services rather than being reallocated elsewhere, as we're currently seeing? Will she invest in prevention and early help rather than waiting for mental health problems that develop early in the child's life to turn into crises as they grow up? Will she make sure that children's services professionals are trained to recognise trauma and provide appropriate care that meets the child's needs rather than blaming the child for behaviours that have arisen because of the trauma they experienced? And will she make sure that babies born to parents with the highest risk factors get the support they need from the moment they are born rather than allowing their lives to be written off and wasted? I hope very much that we will hear positive responses from the Minister this afternoon, because no country that loves its children can keep treating them like this.
Thank you, Mr Pritchard. And can I thank all honourable members who have contributed to this afternoon's debate, which has given me a lot to think about and a lot to address. I'd particularly like to pay tribute to my honourable friend, the member for Burton-on-Trent, who perhaps gave an excellent exposition of the challenges before us. But I welcome the contributions of all members who we've covered a lot of content here. I'll do my best to try and address all the points that have been made. Like I said, there's a hell of a lot. And I think the starting point is that, you know, as the Honourable Member for North Durham says, for a long time we just haven't talked about mental health enough. It's been a taboo subject and these issues have been left to fester. As a consequence, mental health has been a Cinderella throughout public services, in truth. People with mental ill health have suffered discrimination at the hands of the state in very, very many ways. We now have an issue whereby clearly we've identified that children's mental health services have been underfunded again for generations, and we are going to have to fix that. Of that, there is no doubt. And unfortunately, that takes more than a magic wand. It requires investment. It requires all commissioners to step up to the plate. It requires good partnership working between NHS organisations, local authorities, schools, and everyone involved in the system. It is, frankly, a massive culture change. It's one that we need to deliver, because we've heard examples this afternoon of where individual children are being failed by poor service, and frankly that is the state's failure, and that's something that we are all duty bound to put right. So I am grateful actually for honourable members to give me these examples, challenging though they are, because they are a helpful reminder to the system that these are individual people here. People like Drew should not be having to wait 15 months for an appointment. And I know that he and I, the Honourable Member for Barrow-in-Furness and I, and indeed the Honourable Member for Westmoreland and Lonsdale, have talked specifically about the challenges in Cumbria. And I think that's something that, in terms of delivering this transformational improvement we're aiming for, what we're seeing actually is a real lack of consistency in the speed and quality of services as they're being rolled out. And again, I think that's a challenge for us as a system. It's something that in my contacts with NHS England, are very keen to make sure that we are getting more uniformity in provision. And in answer to the Honourable Gentleman's point about ring-fencing funding for mental health services, I think NHS England will be giving very direct challenge to CCGs in accordance with just how much money they are spending on mental health services. We are very clear that they should be spending more than the increase in their budgets. And while in the past we've always rejected the suggestion of a ring fence on the basis that it can often be seen as a ceiling, and we don't want it to be that, I think there is room now for some very challenging comments, because we really need to start thinking about whether what we have in place really is delivering the outcomes that we all in this room and as a society we ought to be able to expect. There's so much to cover, and I'm sure I'll miss something points out, but some of the real points that I want to emphasise. The Honourable Member for North Durham, when he talked about the role of the voluntary sector in this is music to my ears, and I've said repeatedly that actually good support for people with mental health doesn't necessarily have to be medical. In fact, the wraparound service that can be provided just by company and comfort is far better delivered by organisations in the voluntary sector. But it is part of our health offering. And I am very challenging with CCGs and commissioners that really they should be thinking about commissioning services from the voluntary sector, because the taxpayer should be funding this where it's delivering an outcome that we want to see. And they can do it better and cheaper than medicalising the problem. So I can't say that enough. And I think in terms of developing more efficient pathways for people, clearly the ability to triage people to services which aren't medical and which can act more immediately, more fleet of foot, can clearly provide an opportunity for early intervention that is going to deliver the better outcomes for people that we want to see. And looking particularly at individual groups of people, we've had references to people with neurodiverse conditions today, people with ADHD, ASD, dyslexia. Quite often these things go undiagnosed, and we need to make sure that people within schools are not just treating people as difficult, but actually signposting them to places where they can perhaps get some additional help. And we know that earlier diagnosis of those conditions can be the difference between developing mental ill health and not. So we absolutely must do better in that. So I guess in terms of the next wave of delivering a transformation for children, obviously we need to continue the pressure with delivering better mental health service for children. But key to that for me is getting earlier diagnosis of autism and ADHD. And I am not shy about articulating the benefit for society of this. This is not just for the benefit of those children, although of course they deserve that and they deserve the best services. But we've heard about the impact of trauma, and everyone who's mentioned that are absolutely right. And we have no excuse for failing those people and not putting the support around them when they need it. Because not only do they deserve that, but actually we win. We win as a society. You know, like I say, you know, these people end up in the care system at best and in prison at worst. Our prisons are full of people who have been failed by the state because we haven't given that hand up when we needed to. So we've absolutely got to grasp this, and I'm not shy about raising that challenge. And yes, it's good value for money because I'd rather be spending more on health than prisons. Thank you very much. And I'm sure I speak for all honourable members when I say so. So absolutely, we need to be making sure we're supporting people when they need it and recognising the impact of trauma. Honourable members will be aware of the work that's being that was being led by my honourable friend, the member for Northampton, when she was in government, but she has a debate on it later this afternoon in terms of the support given people in the first... In fact, she's on now as we speak, where she will be echoing some of the points that I'm sure the honourable member for Croydon made in terms of, you know, we can see the children who are at risk, and, you know, the state has every opportunity to give support to those people, and frankly, we should be a lot more assertive in doing so. And as I say, you know, society, those individuals will benefit, society will benefit, and of course the taxpayer will benefit because we won't be spending money on failure. The honourable member for Coatbridge, Kristen and Bells Hill, spoke very movingly about the increase in suicide in young people. And I think we, collectively across government, need to get a better understanding of how, right now, the pressures facing young people seem to be a lot more acute than when I was growing up. And to put it bluntly, when I was growing up, I used to play at being Charlie's Angels. I didn't used to expect to look like them, which might seem a trite thing to say, but the pressure about body image is giving a massive pressure on our young people. We used to think that kids were going to be safer in their bedrooms than going out to play on their bikes. That's no longer true, because the way that people are rooted through content when tackling social media leaves them very much at risk. And although we can celebrate actually the revelation and opportunity that the internet and social media has given our young people, it does bring with it risks, and I think we do need to be a lot more on top of them. And I'm glad to say that I am now in regular dialogue with those companies. And to be fair, they're stepping up to the plate at this stage, but you know, that's not to say that we shouldn't consider legislation where we can see that would bring some value in protecting young people. We've said about funding. Obviously, we have made commitments to increase funding. We will continue to do that because we do need to make sure that we are meeting the unmet need that has been alluded to today. And as I say, money spent early is money spent wisely and money spent less. So we must absolutely continue to do that. And the principle of early intervention is totally inarguable when the expenditure on acute service is so much more costly. We've talked about waiting times. I think, you know, I'll take away, we need to get a much better handle on those areas that have particularly long waiting times, because we have set targets. We do see that 80% of young people with requiring urgent cases are seen within a week. But again, it comes back to the extent to which we are triaging those services. But the really important thing about early intervention and getting support to children at an early stage is our proposals, and my honourable friend alludes to the project that's starting in his constituency for the mental health support teams to work with schools directly. They will be able to equip the schools themselves with more material and support to help them embed mental well-being throughout the curriculum, but also to be that place for additional support and that place where services are going to be referred. So I thank all honourable members who have contributed to this debate. We are on it, but I'll be the first to admit that we still have a long way to go to really deliver mental health services for children that we can all be proud of. Thank you.
Andrew Griffiths to wind up.
Thank you, Can I just say, at a time when the public often look in on this place with derision and sometimes with desperation about how we behave, I think today this debate has shown Parliament at its best, actually. Lots of consensus, lots of heartfelt cases brought forward, and lots of determination to make a difference. I think we all recognise that the issues that we are talking about today involve young people who are in a desperate state, and parents who are equally as desperate about the future of those children. If we can come together and to deliver that early intervention, deliver those support mechanisms that can make such a difference later on in life, we can literally save the lives of those young people. I thank everybody that's contributed today to a really positive debate, and I hope that it's just a springboard to go further and make sure we deliver for all of those young people across the country.